Click on. There we go. Here we are live. So this is patient number, happy patient number 4 today. Good day. Really nice. We're super happy patients today. What a great day. The stars must be aligned. Sarah had a problem with her sacroiliac joint. And this is a procedure that I did probably 10, 15 years ago. And I wasn't super pumped about the results. I felt like I got about 50% results, which to me is not a good enough number to really be aggressive with this. There's a new product that has come out recently, and I think it's a better system. It's a safer system. It's a system that has recently become available. So I decided to give it a second chance. Anyway, and so this is where one of the SI joints or sacroiliac joints, basically where the iliac wing connects to the sacrum, becomes arthritic and painful. And of course, we try things like medications and stretching and therapy and shots to diagnose it by numbing it up and so forth. And Sarah definitely responded to those, but continued to have a lot of pain, was very miserable, and miserable enough to where we felt like it was worth going ahead and taking a swing at this. The incision's tiny. You went home the same day? I think you went home, or did you spend one night? Yeah, I went home the same day, so it was an outpatient procedure. And the incision was less than an inch. We just looked at it. It looks great. So we'll let Sarah tell her side of the story. So tell us, Sarah, the pain you were having before, how long ago you had the procedure, and how much pain you're having now. Are you satisfied with the results?
So before, I've got a couple of different issues with my back, but this has been going on with your practice probably 5 years, five and a half.
So yes, I drug my feet. Out. You're probably wishing I'd done it sooner now, right?
Yeah, there were several issues we needed to address. So there were some upper issues and then this lower issue, but we fought with it, had to keep increasing medication. We were trying all kinds of physical therapy, alternative massage therapy. We tried everything and just kept having to up the medication, and it just really wasn't helping. And I wasn't able to do the things that I need to do, as a mom, as an employee, whatever. And so we finally just got to that point where we needed to do the procedure. It was a one, in and out, same day procedure. And I'm post-op about
6 weeks.
6 weeks.
You're about to say, yeah, this is considered your 6 weeks post-op. And we did not try to talk you into that procedure. In fact, I was a little bit discouraging probably just because I was...
When I left, I was like, oh, I don't know. He didn't sound like really, amped. He's saying, well, it might work, it might not work. And I was thinking, I don't know. But I was at the point where I was miserable.
Well, I've learned that if I lie to you, you're going to know after surgery. So I'm real careful about trying not to do that.
Well, it was a very informed decision. I didn't take it lightly, and surgery is a big decision, to make. And you've always been pretty honest with me about just because you have a back and I have a skeletal doesn't mean that we need to go that direction.
That's right.
We've pretty much exhausted everything, but I would say that this has dramatically improved my
So your pain's a lot better. The problem is once you fuse that joint, now a lot of the stress goes to L5S1, and now you're feeling a little bit of discomfort in L5S1. That's sort of the trade-off. But, and the surgery itself is small. It was a tiny incision. Like we said, she lost about a tablespoon of blood, if that. She went home the same day. So the surgery isn't the issue. It's just whether it's going to work or not, locking up the motion in that joint. But sure seems to have worked.
So far, so good.
So we'll keep everybody posted, and we'll certainly keep tabs on her. But you're zero pain, basically, no pain, and you're not
just at that L5S1 a little bit, and then.
But where we did the procedure, the SI joint, it's gone, and you're not even taking a lot of pain medication at this point, and you're more active than you were before.
Absolutely.
Awesome, and we're pretty much going to let you go back to your activity to some degree. There's still some fusing going on there, but I don't want you going and lifting heavy boxes or pole vaulting quite yet. But we're going to let you kind of go back to your activity, and then in probably another 6 weeks or so, you should be 100%. Everything should be pretty completely healed up.
Good to go.
Awesome. You do it again. You would do it again.
Absolutely.
Okay. That's always the big question. Would you do it again? Are you happy? Would you do it again? Awesome.
Absolutely.
Awesome.